And joining us now to answer some of your questions about the coronavirus is Dr. Deepa Verma with Synergistic Integrative Health. Dr. Verma, one of the questions we get a lot is if somebody gets the coronavirus, they think they've been sick from it, they get better, can they contract it again?
I think reinfection is really not plausible. I think what the problem is a failure in testing process. So they're probably getting some false positives. But typically when you get infected with a virus, your immune system will start producing antibodies, which will keep you immune to it from the future. So though we are dealing with a novel virus where mankind has never encountered it before, and this is why it's now a global pandemic, it's still a virus. And when we get exposed to something, our immune system develops antibodies. So it's unlikely you're going to get reinfected. I don't think it was just this testing issue, really. They're not as picking up the false positives or negatives. That's what's going on.
So if you get the virus, does it affect your immune system other than building up an immunity for the novel coronavirus? Could you become more susceptible or less susceptible maybe in the future to other viruses?
Well, for now, again, this is something that's completely new to mankind, so this is why it's kind of ravaging us right now. But if you actually look at the statistics, it's really affecting the elderly population. So as each decade goes up, that's where it's affecting. So it's not going to, I don't think either way it's going to really make a difference, but what matters most is what your existing and concurrent comorbidities are and your medical conditions are. Typically in the elderly you're going to have more issues, and anyone who also has issues with breathing or lung issues, asthma, or they're smokers, they're going to get hit harder because this is where the virus is being, sequestered.
And I guess that goes to the point of if you are older, and if you do have some of those issues like lung issues and heart health issues, maybe you have to be really, really super careful and maybe just kind of self-quarantine at home and try to ride out the storm if you can.
Yeah, this is where the social distancing is going to come into effect, as well as flattening the curve. So people are going to ask, does this really make a difference? Right now, yes. Extending the time as trying to flatten the curve is going to be key, because it's going to give us that more extra time to find a cure, to develop prophylactic cures, and also develop a vaccine. So right now it's necessary, but the key is going to be, the measurable difference we're talking about here is going to be actual testing. And if we look at the countries like South Korea that have done so, this is where you'll see a significant drop in the cases. We need to identify. There has to be basically like a stochastic statistical graphing of this to actually look at where it is. Where is this virus? If we don't report it in a certain area, are they not looking for it? Are they not testing for it? So we have to make sure everybody's getting tested and make it available to everybody, just like something they can do at home and swab themselves. That's going to be key in flattening this curve into finding a cure and developing a vaccine.
Got a couple real quick questions for you. The virus is airborne. How long can it just kind of stay in the air and somebody still get enough of it to make them sick?
So when we say airborne, that's a respiratory droplet. So it's basically a water droplet that lingers in the air, similar to fog. This is what happened with the measles as well. So if I sneeze or cough, and I'm talking about it being airborne, that droplet is going to be suspended in air for up to 3 hours. So if anybody comes around that droplet in that amount of time, they're likely to pick it up. There's still controversy to say whether coronavirus is really airborne. We know it's a respiratory route of transmission, obviously inhaling it or getting it through the mouth or the eyes or the nose. So that's basically a time frame that they're looking at is about 3 hours that it can survive in the air.
All right, Dr. Verma, thank you so much for joining us.
Thanks, Rick.